Our today's topic is abdominal aorta and its collateral branches in cattle. So we will discuss about the abdominal aorta and the different collateral branches which arise from it. So as we know, the posterior aorta or the descending aorta, it is divided into two parts, thoracic aorta and the abdominal aorta. The thoracic part of the posterior aorta is known as the thoracic aorta, while as the abdominal part of the posterior aorta or descending aorta is known as abdominal aorta. So two parts are there, thoracic aorta and abdominal part aorta, which are the parts of the posterior aorta or descending aorta. The thoracic aorta we have already discussed. Now we will discuss about the abdominal aorta. The abdominal aorta, it extends from the hiatus aorticus and it terminates below fifth or the sixth lumbar vertebrae by dividing into two external and two internal iliac arteries. Then the abdominal aorta will continue as middle or median sacral artery. So the abdominal aorta extends from hiatus aorticus and then at the level of fifth or the sixth lumbar vertebrae it quadrifies. That means it divides into two external and two internal iliac arteries. The external iliac artery they supplies to the hind limb, while as the internal iliac artery they supplies to the wall of the pelvis and the viscera. Then after giving the two external and two internal iliac arteries, the abdominal aorta then will continue as median sacral artery. The abdominal aorta, it supplies to the abdominal wall, it supplies to the different organs that are present in the abdominal cavity like the rumen, reticulum, omasum, abomasum, liver, pancreas, gallbladder, intestine, small intestine, large intestine. It also gives branches to the spinal cord. It supplies to the pelvic cavity and the wall of the pelvis with the help of the internal iliac arteries. And the hind, it also supplies to the hind limb. The hind limb, they are supplied by the external iliac artery, which arises from the abdominal aorta at 5 or 6th lumbar vertebrae. Now, there are different branches which arise from the abdominal aorta. First one is the celiac artery, then anterior mesenteric artery, then renal artery, lumbar arteries, internal spermatic artery, and posterior. There are 6 collateral branches which arise from the abdominal aorta. So these arteries, they can either be parietal or they can either be visceral. The parietal, they means they supply to the wall of the cavity like the abdominal wall or the thoracic wall, while as the visceral means the arteries we supply to the visceral organs. Some arteries they are unpaired, while as some arteries they are paired. Like the celiac artery, it is a visceral artery and it is unpaired. That means it arises singly. The anterior mesenteric artery, it is again visceral artery and it is unpaired. The renal artery, they are 2 in number, they are visceral and they are paired. The lumbar artery, they are parietal and they are paired. Same, the internal spermatic artery, internal spermatic or testicular artery, their nature is visceral and they are paired. While as the posterior mesenteric artery, their nature is visceral and they are unpaired. So from here the diagram you see this is the abdominal aorta. So this is the abdominal part of the posterior aorta. So here this is the diaphragm. So when the aorta enters into the diaphragm, the first artery that arises, this is the celiac artery, then gives the anterior mesenteric artery, then these are the renal artery, then this is here from the dorsal face, here these are the lumbar arteries. This is the testicular artery or internal spermatic artery, and here you can see this is the posterior mesenteric artery. So these are the different branches of the abdominal aorta. And finally, at fifth or the sixth lumbar vertebrae, it undergoes quadrification by giving it in two external iliac arteries and then two internal iliac arteries, and then it will continue as a median sacral artery. Now coming to the first collateral branch of abdominal aorta, that is known as celiac artery. The celiac artery, so when the aorta enters into the abdominal aorta through the aorticus, the first artery that arises from the abdominal aorta is the celiac artery. So it arises from the ventral face of the abdominal aorta. So when it arises, it goes downwards on the left face of the rumen. Then it turns forwards and then towards the right side. So on the left, this celiac artery, it is related with rumen and pancreas, and on the left it is related with right crura of diaphragm and posterior vena cava. And this celiac artery finally then continues as omeso-abomasal artery. So it goes downwards on the left face of the rumen, then goes forwards and turns towards the left. On the left, it is related with the rumen and pancreas, and on the right, with the right crura of the diaphragm and the posterior vena cava. So there are different collateral branches of the celiac artery. The first one is the hepatic artery. So when the celiac artery, when it crosses the posterior vena cava, so it gives off an artery which is known as hepatic artery. So the hepatic artery further gives these following branches. So the pancreatic branches we supply to the pancreas. So the pancreatic branch arises from the hepatic artery. Hepatic artery in turn arises from the celiac artery, and celiac artery in turn arises from the abdominal aorta. And the next collateral branch is of the hepatic artery is the right and the left hepatic branches. So right and the left hepatic branches, they supply to the corresponding lobes. Means the right hepatic branch, it supplies to the right lobe, and the left supply to the left lobe of the liver. The left hepatic branch being larger, it gives off right gastric artery. The right gastric artery, it supplies to the initial part of duodenum and pylorus. And finally, it anastomoses with omeso-abomasal artery. Then the next branch is the cystic branch. The cystic branch, it supplies to the gallbladder. Then gastroduodenal artery. The gastroduodenal artery divides into pancreatico-duodenal and right gastroepipodic artery. The pancreatico-duodenal artery, it supplies to the pancreas and the duodenum, and this pancreatico-duodenal artery, it anastomoses with the anterior mesenteric artery. While as the right gastroepipodic artery, it supplies to the pylorus, and this anastomoses with the left gastroepipodic artery. So next collateral branch of the celiac artery is the right ruminal artery. The right ruminal artery, it arises by a common trunk with the splenic artery. So the right ruminal artery, it goes downwards and backwards on the right side of the dorsal sac of the rumen. Then it reaches the posterior transverse groove. So after crossing the posterior transverse groove, it turns towards the left side of the rumen. And here it anastomoses with the left ruminal artery. So the right ruminal artery, it supplies to the whole right side of the rumen and the posterior 1/3 of the left face of the rumen. Plus it gives branches to the pancreas. Now coming to the next collateral branch. The next third branch is the left ruminal artery. So the left ruminal artery, it is again a collateral branch of the celiac artery. The left ruminal artery, it also passes on the right side of the rumen. It goes downwards and forwards, then crosses the anterior transverse groove. So after crossing the anterior transverse groove, it turns towards the left side of the rumen. So on reaching the left face, it then runs backwards through the left longitudinal groove, and then finally it anastomoses with the right ruminal artery. So the left ruminal artery, it supplies to the anterior 2/3, while as the right ruminal artery supplies to the whole right side plus 1/3 of the left side of the rumen and the pancreas. Here the left ruminal artery, it supplies to the anterior 2/3 of the left side of the rumen. It also gives of a reticular artery which supplies to the reticulum. Now the next branch is the splenic artery. The splenic artery arises in common with the right ruminal artery. This splenic artery, it passes over the dorsal sac of the rumen and then reaches the hilus of the spleen. So splenic artery, it supplies to the spleen. Next is the phrenic artery. The phrenic artery, it is a small blood vessel which supplies to the diaphragm. Now the omeso-abomasal artery. The omeso-abomasal artery, it is the continuation of the celiac artery. This omeso-abomasum, it runs over the greater curvature of omesum and divides into dorsal and ventral branches. The dorsal branch, it is also known as left gastric artery. It passes over the greater curvature of the omesum and lesser curvature of abomasum. So during this course, it gives branches to omesum and abomasum, and finally it anastomoses with the right gastric artery. Whereas the ventral branch or the left gastroepipodic artery, it passes over the greater curvature of the abomasum and lesser curvature of omesum, giving branches to the omesum and abomasum, and finally the ventral branch or the left gastroepipodic artery anastomoses with right gastroepipodic artery. So these were the different collateral branches of the celiac artery. The first was the hepatic artery, second was the right ruminal, then the left ruminal, then splenic artery, then phrenic artery, and the final omeso-abomasal, which is actually the continuation of celiac artery. So this is the flowchart of the celiac artery. So the celiac artery gives different collateral branches. This is hepatic, this is right ruminal, the left ruminal, then splenic, then phrenic, and the continuation is omeso-abomasal artery. So the hepatic artery, that further gives off the pancreatic branches which supply to the pancreas, the cystic branch which supply to the gallbladder, right hepatic branch and the left hepatic branch which supply to the corresponding lobes of liver. The left hepatic branch gives off right gastric artery which anastomoses with the left gastric artery of omeso-abomasal artery. Then the gastroduodenal artery. The gastroduodenal artery divides into pancreaticoduodenal and right gastroepipodic artery. The pancreatico-duodenal artery, it supplies to the pancreas and duodenum, and finally it anastomoses with anterior mesenteric artery. While as the right gastroepipodic, it supplies to the pylorus, and this anastomoses with the left gastroepipodic artery, which is a branch of omeso-abomasal artery. So this is the flow chart of the celiac artery. So here in the diagram you can see this is the abdominal aorta, and this is a thick and short blood vessel which is known as celiac artery. From the celiac artery, this is a common trunk which gives rise to the splenic artery, which supplies to the spleen, and this is the right ruminal artery. This goes downwards and backwards and passes through the posterior transverse groove and then turns towards the left. This turns towards the left side of the rumen, and here it anastomoses with the left ruminal artery. That is this. This is the left ruminal artery. So the left ruminal artery, it also gives of a branch, this is known as reticular branch, which supplies to the reticulum. This is the hepatic artery, which gives of different branches: pancreatic, cystic branch, and gastroduodenal, which divides into pancreatico, duodenal, and right gastroepipodic artery. And this is the continuation of the celiac artery, that this is omeso-abomasal artery. It divides into the left gastric artery and the left gastroepipodic artery, this which finally anastomoses here. This is the left gastroepipodic anastomoses with the right gastroepipodic, and this is the left gastric which anastomoses with the right gastric artery. So this was all about the different branches of the celiac artery, which supplies to the different parts of the rumen, the pancreas, the liver, and other organs. Now the second collateral branch of the abdominal aorta is the anterior mesenteric artery. The anterior mesenteric artery, so it arises from the ventral face of the abdominal aorta immediately behind the celiac artery. The first artery that arises from the abdominal aorta was the celiac artery, and then immediately behind the celiac artery is the anterior mesenteric artery. So the anterior mesenteric artery gives collateral branches like pancreatic branch, which supplies to the pancreas, and middle colic artery, which supplies to the terminal part of the colon. The anterior mesenteric artery finally divides into two divisions: the posterior division and the anterior division. The posterior division, it is also known as iliocecocolic artery. This iliocecocolic artery divides into ileocecal artery and colic artery. The ileocecal artery supplies to the ileum and cecum, while as the colic artery supplies to the colon. Now the anterior division of the anterior mesenteric artery, it also gives two branches. The one branch that supplies to the posterior 1/3 of small intestine, and the another branch which supplies to the anterior 2/3 of the small intestine. Both these branches, they pass through the mesentery, and the anterior division in general supplies to the small intestine, except the initial and terminal part of the small intestine, and it also supplies to the mesenteric lymph nodes. So this was all about the anterior mesenteric artery. So here in the diagram you can see this is the anterior mesenteric artery. It gives here two divisions. This is here ileocecocolic artery, that is the posterior division. it divides into the colic artery here, which ramifies on the colon, and this is ileocecal artery, which supplies to the cecum and the ileum. This is the anterior division, which divides into two branches. It gives the first branch, which supplies to the posterior 1/3, while as the second branch, which supplies to the anterior 2/3 of the small intestine. So this is the anterior division. This is posterior division. Anterior division gives two branches. One supplies to the posterior 1/3 and the second supplies to the anterior 2/3. And the second branch, and finally here it anastomoses with the first branch of the anterior division. Now the third collateral branch of abdominal aorta is the renal artery. The renal arteries, they are two in number, right and left. Their nature is they are visceral and pure. So the left renal artery, it is longer, and these renal artery, they supply to the corresponding kidney. That means right renal artery supplies to the right kidney and the left supplies to the left kidney. So the renal arteries also gives off branches to the ureter, the renal lymph nodes and adrenal glands. Now the next collateral branch is the lumbar artery. The lumbar artery are generally 6 pairs. These, out of the 6, the first 5 pairs, they arise from abdominal aorta, while as the 6th pair, they arise from the internal iliac artery. Their course and distribution is similar to that of intercostal arteries. So when each lumbar artery, when it arises from the dorsal face of abdominal aorta, it goes across the body of the lumbar vertebrae and then divides into two branches, dorsal branch and ventral branch. The dorsal branch further gives supinal branch and muscular branch. The supinal branch, it enters into the supinal canal and it supplies to the supinal cord, and finally anastomosis, or it reinforces inferior supinal artery or ventral supinal artery. The muscular branches, they supply to the muscles of the loin region. The ventral branch, they supply to the abdominal muscles and skin. Next is internal suprametic artery. It is also known as testicular artery. So it is visceral, it is paired. So it arises from the abdominal aorta close to the origin of posterior mesenteric arteries. So the internal suprametic artery, it goes downwards, then backwards, and traverses along the lateral wall of the pelvic cavity, then reaches the inguinal canal and gets incorporated in the suprametic cord. So this internal suprametic artery, they supply to the testes, epididymis and tunica albuginea in case of males, while as in the females, this artery is known as utero-ovarian artery, which passes through the broad ligament of the uterus. So this utero-ovarian artery, it divides into anterior uterine artery, which supplies to the horn of the uterus, and the ovarian artery, which supplies to the ovary. The anterior uterine artery anastomoses with middle uterine artery, which is a branch of internal iliac artery. The next collateral branch of abdominal aorta is the posterior mesenteric artery. The posterior mesenteric artery, it is a visceral artery. It is again unpaired. It arises from the ventral face of abdominal aorta behind the origin of suprametic arteries. So posterior mesenteric artery is divided into two branches. One is the colic branch, it's also known as anterior branch, It is a short branch among the two and it supplies to the terminal part of colon. While as the another branch is known as posterior branch, hemorrhoidal branch or rectal branch, which supplies to the rectum. Thank you.